presentation to see if everything is working properly.
Until it's okay.
Yeah, okay, good. Can you see it well?
Yes.
Perfect. Thank you so much. So, as I said, I couldn't fully understand the initial words, but just to also give a short frame. So, I'm Carina Dantas. I'm Portuguese. I have an SME called Shine to Europe, based in Portugal, which works mainly around the promotion of inclusive communities. Of course, this concept of trying to enhance inclusion is very much related to also ensuring that everyone is represented when we talk about the sharing of health data. So we work mainly around European research, applied research, very much around ethics and policy, and also social innovation. We currently have around 20 plus projects ongoing on different European funds, and a lot of them work around digital tools for health. So the whole issue about the sharing of health data is also circular to a number of them, very often connected as well with the use of artificial intelligence. And of course, I don't need to say this to anyone, but the truth is that there are a number of good aspects for sure of the possibility of having better data sharing, more personalized medicine, and of course, the use of AI for societal good. But this is not only fully consensual. On the right side, let's say there are a number of potential benefits as having better diagnosis, better treatment. Of course, the big issue of personalized care, for example, in cancer care, where I personally do a lot of activism, the idea of having a personalized understanding of what can be your best treatment and what can be done for you specifically instead of using only generic guidelines. This is, of course, a huge landscape for the future that for sure will help to tackle a lot of NCDs, such as cancer, for example. And this, of course, means as well that public health will be improved and cost efficiency would come. In fact, according to several surveys, here I pasted one, but there are a number of different ones. In general, people say that they support the sharing of health data for research purposes, for the provision of healthcare. However, there is still a number of issues that arise, for example, like being trustworthy on the security of data or what happens with it. And there is always a bit this ghost of what will happen with my data, how will it be used in the future, and eventually if it can come against me in future healthcare decisions. This is very connected with the overall understanding of the ethical use of data and also how it can be commercialized in different situations. I didn't put it here, but I remember having one of these surveys with a lot of people in Europe answering maybe around 1,000, where well, maybe 70, 80, 90% were saying that they were okay with sharing their data with a health or research organization, but less than 10% would be available to share with the company, a for-profit organization. And this is because I think there is still a lot of this idea that data may be used for the wrong reason and may be commercialized. Of course, it's not the nature of the organization that does this, but this is, of course, a legitimate concern, which is still not fully addressed and needs for sure some more work. Then we have bigger issues. These are some of the societal issues, but we also still struggle with a lot of fragmented systems for interoperability, with standards that are not fully aligned. And this is for sure something which directly impacts the implementation of the European health data space. So we can say that from the side of the patients, the systems, as I was saying, are less of an issue. Of course, they are a big transversal issue. But from the side of the patient, there's a lot of issues still with equality in access to the systems. The overall sharing of data is based on digital support, and this, of course, is not still fully solved for those who are less literate or have less access to digital tools, for example, as the older population. And it is still quite complex to tackle all of the issues regarding the use of digital tools. For example, a patient in a focus group was saying that, well, I just tick the consent form as I do on every online privacy notice. So I don't really read it, or I'm not fully aware of what it means. I just tick it so that I can proceed. This is, of course, something that is not fully helpful to be able to ensure that people are actually aware of how things are processed, and therefore that their concerns are legitimate. The truth is that this big data sharing is still fostering some concerns in terms of trust. The Eurobarometer was saying that most patients were willing to share their data if they trust the system, but this trust is still something very complex and difficult to ensure. And to enhance this trust, people want to have more transparency. So they want to know how their data is being used, who is using it, and for which purpose. Of course, this is impossible to track, especially if you are working with pseudo-anonymized or anonymized data, and if you are working already with, for example, the secondary use of data. But there needs to be some kind of information that can be allowed to patients to understand what will be the purpose of sharing their data, so that this becomes clearer and perhaps also streamlined in more options and possibilities. And of course, then there's always something that people tend to address, which is to try to understand who at the end will own their data. Can they access it at any time? Can they ask to delete it? Of course, the GDPR states a number of things, but then in practice, it is difficult to understand how to make this actionable. And there are still a lot of electronic health records which are not electronic. We still have a lot of paper records. And even if these didn't raise before a concern in the patient's mind, the truth is that there's a lot of health data that is still in different places where it cannot be easily retrieved, like old storages or archives in hospitals. So in truth, most people seem to say that they would prefer to have a good electronic access to their health records, but still, this is far from being a reality in terms of the infrastructure in different countries. So, what can we say from the side of patients? Well, we need to have a better dialogue between people in general. That means either patients as those who are actually suffering from a disease, but also all of us as citizens as we go along life in our different roles. And citizens and patients need to be seen as partners, not just as data providers. So it's good to understand that some people will want to know more about their health data sharing, others won't. But anyway, we should have as much as possible places where this open dialogue works. Because if we have better data, then of course we'll have better healthcare, and this is good for everyone. Because at the end, what we want is to increase the possibilities of having healthier lives, and this, of course, is good for all of us. So, how do we work at Shine in this area? Well, we try to tackle the issues around promoting better inclusion, which also include here the discussions on health data through three key areas. So on one side, trying to provide more knowledge, and especially bringing social innovation and social sciences as a key aspect of this discussion. Then trying to produce this knowledge not only for research purposes, but especially also to inform policy. So it is very important that everything that we gather through the research process is also translated to evidence-based recommendations that can help policymakers to take decisions. And as the third pillar of this, let's say, try to use also this information to guarantee that people receive reliable information, that they have good tools, and that they feel more empowered and able to participate in discussions around different topics. So in truth, we work a lot around this idea of fostering a more trustworthy AI, which is still something which will take a long time to ensure. But what we try to align is the different actors and stakeholders involved in the processes with the technology and then with the implementation aspects of the health systems. So for this to work in different areas of research, we try, of course, to go through the different points more digitally connected that ensure a more trustworthy AI, such as, for example, fairness, traceability, robustness, etc. Also taking into account that people always need to be taking the decisions, so ensuring human agency and, of course, data safety and data protection. But a big focus is how to put this in practice, so working around the pathways towards implementation. For ensuring that something will actually reach us as patients, as people, we need to make sure that the different breadth of stakeholders are involved. So not only researchers or not only public authorities or industry, but having all of us in the loop and ensuring that we are all talking to each other and producing further knowledge together. So for this, we try to have in the different projects a good work around stakeholder engagement and having different workshops, social innovation labs, living labs, different policy sessions where people come together and try to discuss the different issues that arise on a specific context regarding a specific tool that may enable it to work better. So for example, here we have this clustering of the different challenges that goes for at the individual level, technical level, organizational or societal, and we try to address them one by one, providing either solutions that can work or identifying those challenges that are still out of our hands to solve, but that we can provide, for example, back to policymakers or to other actors to be addressed in the future. So at the end, we do think that if we put together all of the relevant stakeholders, but actually together discussing and collaborating and be sure to understand the societal challenges around each of the topics, then we can promote more inclusiveness, more participation in developing the different products and services, and at the end, be sure that people actually understand what they can benefit from. They are literate enough and educated enough to provide their opinions, and they can then fully be engaged in promoting, in this case, a more trustworthy AI, a better access to health data sharing, and increased outcomes in terms of policy. So in short, patients want for sure more to be able to trust any digital solutions, and the HDS is not different from this. Understand how they work and have some control over their data sharing. And of course, the HDS presents a wonderful opportunity to ensure this, but we really need to include patients and citizens in all of the discussions. Because at this point, also at the EU level, European in general, we need to ensure that we, despite all of the pressure to be stronger at the commercial level, that we still need to ensure a number of guiding principles and state clearly that ethics and an ethical use and sharing of data is still on our key priorities. This leverage between allowing innovation to progress and ensuring that it is ethical and respects all of our main societal principles is not easy, but I do think that we can work along this and try to make a good balance of it. Thank you very much. I hope this was relevant enough for this discussion, and I'm very happy to reply to any questions that may exist. Thank you.